Your heart has been beating every second of every day since before you were born. It has never taken a day off, never paused, never asked for rest. Through stress and grief and joy and exhaustion, through every season of your life, it has continued, pump after pump after pump, moving blood through 60,000 miles of vessels, delivering oxygen and nutrients to every cell in your body, removing the waste those cells produce. But your heart can struggle, and when it does, it rarely announces the problem the way we might expect, with a dramatic moment that is unmistakable and impossible to ignore. More often, it sends quieter signals, signals that are easy to attribute to something else, to getting older, to being out of shape, to a bad night's sleep, to the heat, to stress, to 100 other things that are so much less frightening than the truth that what you are actually experiencing may be the early warning system of a heart that is working harder than it should and beginning to fail. Heart failure affects approximately 6.2 million Americans. It is the leading cause of hospitalization in adults over 65. And despite its name, heart failure does not mean the heart has stopped. It means the heart can no longer pump blood efficiently enough to meet the body's needs, a condition that develops gradually, produces a specific and recognizable constellation of symptoms, and that, when identified and treated early, can be managed effectively enough to maintain quality of life, prevent hospitalization, and extend meaningful, active years of life. Today we are going to talk about 7 warning signs of heart failure, signs that your body produces when the heart's pumping efficiency is declining, that are routinely overlooked, misattributed, or dismissed until the condition has progressed to a stage where treatment is substantially more difficult and the prognosis substantially more guarded. This video is not designed to cause fear. Knowledge is the antidote to fear, and the knowledge of what heart failure looks like in its early stages, communicated clearly, specifically, and with the biological explanation that makes each symptom comprehensible, is precisely the kind of knowledge that transforms a frightening diagnosis into an early opportunity for intervention. Everything in this video should be shared with the people you love, with the people who love you, because the person most likely to recognize the early signs of heart failure in someone they care about is not a physician. Physicians see their patients for 15 minutes twice a year. The person most likely to notice is the one who shares a life with them. Let us begin with a clear picture of what heart failure actually is, because the biology is what makes every symptom make sense. The heart is a 4-chambered pump. The right side receives oxygen-depleted blood from the body and sends it to the lungs for reoxygenation. The left side receives oxygen-rich blood from the lungs and pumps it out to the entire body. Heart failure can affect either or both sides, and the side affected determines which symptoms predominate. Left-sided heart failure, the most common form, produces the back pressure of fluid into the lungs and impairs the delivery of oxygenated blood to the body's tissues. Right-sided heart failure, often a consequence of left-sided failure, produces the back pressure of fluid into the body's venous system, causing the peripheral edema and systemic congestion that gives the condition its older name, congestive heart failure. In both cases, the fundamental problem is the same. The heart is pumping with less than optimal efficiency. The cardiac output, the volume of blood pumped per minute, is insufficient to meet the body's demands. The body responds to this insufficiency with compensatory mechanisms, increasing heart rate, constricting peripheral vessels, retaining fluid to increase the blood volume that reaches the heart, that in the short term maintain perfusion, but in the long term accelerate the deterioration of the failing heart, and produce the symptoms that, when recognized, point unmistakably toward the diagnosis. The 7 warning signs we are about to describe are the body's language for this process, the observable manifestations of a heart that is working too hard to compensate for declining efficiency. Each one has a specific biological mechanism. Each one is recognizable with the knowledge of what to look for, and each one, when recognized and acted upon, shortens the path from symptom to diagnosis to treatment. The first warning sign is shortness of breath with activities that previously caused none, a symptom called exertional dyspnea that represents the first and most common way that declining cardiac output announces itself. When the left ventricle is not pumping efficiently, pressure builds backward into the pulmonary circulation, the blood vessels of the lungs. This elevated pulmonary pressure causes fluid to leak from the pulmonary capillaries into the air spaces of the lungs, reducing the lungs' capacity to oxygenate blood and increasing the effort required to breathe. The result is breathlessness that is disproportionate to the level of activity, climbing a flight of stairs that was never difficult before, carrying groceries to the car, walking from the parking lot to the entrance of a store. What makes this symptom so frequently dismissed is its gradual onset. The change is insidious. People unconsciously reduce the activities that trigger the breathlessness, attributing the reduced tolerance to being less fit or getting older. They stop climbing stairs. They park closer. They rest more frequently. They make accommodations without recognizing that the accommodations themselves are the symptom. A progressive narrowing of activity driven by the heart's progressive inability to meet the oxygen demands of exercise. A study published in the European Journal of Heart Failure found that exertional dyspnea was present in over 80% of newly diagnosed heart failure cases, and that the average time between symptom onset and diagnosis was approximately 7 to 9 months in patients who dismissed the symptom. 7 to 9 months of progressive cardiac deterioration that early recognition could have shortened dramatically. The practical assessment. Notice if activities that were manageable 6 months ago are now producing breathlessness. Notice if you are making accommodations that represent a change from what you previously did without difficulty. These accommodations are not normal aging. They are worth discussing with a physician. The second warning sign is orthopnea, shortness of breath that occurs specifically when lying flat and is relieved by sitting or standing up. If you have begun using multiple pillows to sleep comfortably, or if you wake during the night feeling breathless and find yourself sitting on the edge of the bed to relieve it, this is one of the most specific and diagnostically important symptoms of left-sided heart failure in the entire clinical picture. The mechanism is direct. When you lie flat, the fluid that has been pooling in the lower extremities during the day redistributes into the central circulation. In a healthy heart, this increased venous return is accommodated without difficulty. In a failing left ventricle, it exceeds the heart's capacity, flooding the pulmonary circulation with additional fluid and worsening the congestion that makes breathing difficult. Sitting up, which redirects fluid back to the lower extremities through gravity, provides immediate relief. The number of pillows a person uses to sleep comfortably has long been used by cardiologists as an informal but informative indicator of the severity of left-sided heart failure. This progression, the pillow count rising over months, is a story that unfolds in the bedroom long before it reaches the cardiologist's office. The third warning sign is paroxysmal nocturnal dyspnea, sudden severe breathlessness that wakes a person from sleep, typically 1 to 2 hours after lying down, and that resolves over several minutes of sitting upright. People who experience this describe waking with a sensation of suffocation, a feeling of gasping for air that is frightening and immediately urgent, sometimes accompanied by coughing or wheezing as the congested lungs attempt to clear fluid from the airways. The relief that comes from sitting upright over several minutes is diagnostic. In no other common condition does breathlessness present with such abrupt nocturnal onset and postural relief. This symptom should never be normalized or attributed to anxiety. It warrants prompt medical evaluation. The fourth warning sign is peripheral edema, swelling of the feet, ankles, and legs, which represents the fluid accumulation produced by right-sided heart failure and the body's compensatory fluid retention in response to declining cardiac output. Heart failure edema is bilateral, affecting both legs symmetrically, and tends to progress upward from the ankles over the course of the day. It leaves a visible indentation, a pit, when pressed firmly with a finger and held for several seconds, a finding called pitting edema that reflects the fluid nature of the swelling. Adults who notice that their shoes fit tightly by the end of the day, or that their socks are leaving visible marks on the ankles, or that they have gained several pounds over a week without a change in eating, these are signs of fluid accumulation that warrant evaluation. A rapid weight gain of 2 to 3 pounds over a single day, or 5 or more pounds over a week, is used as a clinical trigger by cardiologists monitoring patients with known heart failure. For someone not yet diagnosed, this pattern of rapid weight gain without dietary explanation is one of the most actionable early warning signs available, because it is measurable, specific, and directly actionable through a scale that most people already own. Before we continue, here is a direct request. Think about the people in your life over 50, your parents, your siblings, your friends, your partner. Have you noticed any of these signs in them? Have they noticed any in themselves and attributed them to something ordinary? Drop a comment below right now. Tell us who this video made you think of and what you are going to do about it. Your comment here matters. It is part of a community conversation that may prompt someone to make a call that changes an outcome. The fifth warning sign is persistent cough or wheezing, specifically a cough that is dry, irritating, and worse when lying down, that has no obvious infectious explanation, and that may produce pink-tinged or frothy phlegm in more advanced cases. As fluid accumulates in the air spaces of the lungs, the airways become irritated and the respiratory system activates cough reflexes in an attempt to clear the fluid. The cough is characteristically worse at night and in the recumbent position and may be accompanied by a sensation of gurgling or rattling in the chest. The distinguishing features of a cardiac cough are its positional relationship, worsening when lying flat and improving when upright, its absence of fever or infectious symptoms, and its association with any of the other warning signs described in this video. A cough that has persisted for more than 3 to 4 weeks without an obvious cause, particularly in an adult over 50 with known cardiovascular risk factors, warrants an evaluation that specifically includes assessment for cardiac causes. The sixth warning sign is fatigue and weakness that is persistent, profound, and disproportionate to activity or rest. When the heart cannot pump sufficient blood to meet the metabolic needs of the skeletal muscles, the muscles experience a relative oxygen deficiency that manifests as fatigue, heaviness, and reduced exercise tolerance. This is not the fatigue of insufficient sleep. It is a physiological fatigue, the body's response to tissues that are not receiving the oxygen and nutrient delivery they require. Research published in the Journal of the American College of Cardiology found that fatigue was the presenting complaint in approximately 65% of newly diagnosed heart failure patients in outpatient settings, and that in many of these patients the fatigue had been present for months before the cardiac diagnosis was made, most commonly attributed to depression, sleep disorders, or the general effects of aging. The question to ask is not whether fatigue is present. Most adults experience fatigue at various points. The question is whether the fatigue is new, whether it is persistent despite adequate sleep, whether it is associated with any of the other symptoms described in this video, and whether it represents a change from the person's previous baseline energy level. The seventh warning sign is heart palpitations, the awareness of the heartbeat as rapid, fluttering, pounding, or irregular, occurring at rest or with minimal activity. When cardiac output is insufficient, the body activates an increase in heart rate to compensate. More beats per minute produces more blood delivered per minute, partially compensating for the reduced volume pumped per beat. This compensatory tachycardia is mediated by the sympathetic nervous system and by neurohormonal activation. Palpitations that are new, that occur at rest, that are accompanied by lightheadedness or near fainting, or that feel irregular and rapid rather than occasional isolated extra beats, warrant prompt evaluation. An irregular heartbeat felt as a rapid, chaotic fluttering may represent atrial fibrillation, which, as we discussed in our stroke video, is itself a cause and consequence of heart failure and requires specific treatment for both conditions. Beyond the 7 primary warning signs, several additional symptoms appear in some forms of heart failure and are worth naming because they are less widely recognized. Nausea and loss of appetite, occurring without obvious gastrointestinal cause, can be manifestations of right-sided heart failure in which venous congestion affects the gastrointestinal tract. Confusion or difficulty concentrating, particularly in older adults, can be a manifestation of reduced cerebral perfusion when the brain is not receiving adequate oxygenated blood. Reduced urination during the day with compensatory increased urination at night, nocturia, is a manifestation of the fluid redistribution that occurs in heart failure when reduced renal perfusion during upright activity leads to decreased daytime urine production while nighttime redistribution of fluid temporarily increases renal blood flow. There is a dimension of heart failure that deserves honest acknowledgement: the relationship between heart failure and depression. Depression affects approximately 20 to 40% of heart failure patients compared to approximately 5% of the general adult population, reflecting both the understandable emotional consequence of living with a chronic limiting condition and the direct neurobiological effects of chronically reduced cardiac output. Research published in JAMA Internal Medicine found that adults with depression who also had unrecognized heart failure were significantly more likely to be diagnosed with their heart failure at a more advanced stage, precisely because the overlapping symptom profile, fatigue, reduced motivation, breathlessness, delayed the recognition of the cardiac component. For any adult over 50 experiencing what appears to be depression alongside physical symptoms consistent with heart failure, a cardiac evaluation should be included in the workup. Understanding what happens when you present to a healthcare provider with symptoms of potential heart failure can reduce the anxiety that keeps some people from seeking evaluation. The initial evaluation is straightforward and non-invasive. A physical examination including listening to the heart and lungs, a 12-lead electrocardiogram, a chest X-ray, and a blood test for BNP or NT-proBNP. the biomarkers produced by the stressed heart muscle that provide a quantitative measure of cardiac strain. The confirmatory test, the echocardiogram, uses ultrasound to directly visualize the heart's structure and function, measuring the ejection fraction that quantifies pumping efficiency. It is painless, requires no radiation, takes approximately 30 to 45 minutes, and provides more information about the heart's status than any other non-invasive test available. None of this is frightening. All of it is manageable, and the information it provides, caught early, opens the door to interventions that meaningfully slow the progression of a condition that, left undiagnosed, accelerates toward a stage where the interventions are fewer and the outcomes less hopeful. Let us now step back and recognize the pattern, because the 7 warning signs do not typically occur in isolation. The appearance of 2 or more, particularly in an adult over 50 with known cardiovascular risk factors, hypertension, diabetes, prior heart attack, valve disease, atrial fibrillation, creates a clinical picture that warrants urgent evaluation rather than watchful waiting. When heart failure is identified early, the evidence-based treatment options are extensive and effective. Medical therapy combining ACE inhibitors or angiotensin receptor blockers, beta blockers, and the newer drug classes including SGLT2 inhibitors and ARNI medications that have transformed the treatment of heart failure in the past decade, can slow or halt progression, reduce symptoms, prevent hospitalizations, and extend life. The lifestyle practices we have discussed throughout this channel, dietary modification, regular appropriate exercise, blood pressure management, blood glucose control, are integral components of heart failure management that improve outcomes independently of pharmacological treatment. Prevention deserves equal emphasis to recognition. The primary risk factors for heart failure are among the most modifiable in all of medicine. Hypertension is the single most common cause of heart failure. Coronary artery disease is the second most common. Diabetes, obesity, sedentary behavior, and excessive alcohol consumption round out the major modifiable risk factors. Every dietary choice that reduces cardiovascular inflammation, every exercise session that preserves cardiac function, every blood pressure reading managed to goal, these are acts of heart failure prevention that the research directly supports. The heart has been working without rest for every day of your life. These 7 signs are its way of asking for your attention, not with alarm, but with information. Information that, acted upon promptly, gives the physicians who care for you the opportunity to intervene before the situation that can be managed becomes the situation that cannot be reversed. If this video gave you something, a new awareness, a symptom you now understand, a reason to call someone you love and have a conversation that you previously did not know how to start, please support this channel. Hit the like button right now, subscribe so you never miss a video, and share this one. Put it where the people who need it will see it. Because heart failure does not announce itself dramatically. It whispers, and the people who hear the whisper are the ones who know what to listen for. Leave a comment below. Tell us if any of these 7 signs are familiar. Tell us if this video prompted you to think of someone who should hear it. We read every comment. And if this video reaches the right person at the right moment, it will have done something that cannot be measured but that matters profoundly. Take care of your hearts. They have been taking care of you. We will see you in the next one.